No problem. Thank you so much for that nice introduction, Lazet. My name again is Dr. Sherryl Hinton Scott. I'm a physician in obstetrics and gynecology. And I know this is an exercise, health, and wellness education party. So I'm going to make it brief, but I'd like to share some pearls with you, just so that's something that you may need now or in the future and that you can take with you. Typically, a gynecologist examines the breast, the abdomen, inguinal area, vagina, and rectum. My main job is to perform an annual exam, which consists of all the things that I mentioned above to examine, and also the pap smear, the infamous pap smear. The pap smear was developed in 1943 and screens for cervical cancer. Let me make sure you understand it screens only for cervical cancer. That's its only function. There has been much discussion and some confusion of how often we should get a pap smear. We begin getting pap smears at 21. It doesn't matter if you're sexually active or not, we usually begin at 21. The chances of you having cervical cancer any earlier than that is highly, highly unlikely. So that is the age that was chosen to begin pap smears. Now, from age 21 to 30, your pap smears can be done every 3 years. From 30 to 65, the pap smear can be performed every 2 years. Please allow me to expound on this. If you have a pap smear that's been normal for 10 years, then you can get your pap smears every 2 years. Now, if you've had an abnormal pap smear in the past, but it's been over 20 years since you've had an abnormal pap smear, then you can still have your pap smears every 2 years. Now, if you've had some pap smear abnormalities, then this does not necessarily apply to you. You may be someone that may require pap smears every 6 months for a short while, or you may be someone that requires a pap smear every year. But basically, what I just mentioned, it fits for the great majority every 2 years. Now, many people are hearing that after 65 or a certain age, you may not need a pap smear any longer. Now, there is some truth behind this, but I'd like to make sure that you understand. After 65, if you've had a pap smear, your pap smears have been normal over a 10-year span, then you really don't require having a pap smear any further. Usually, not having a pap smear and having the history of a normal pap smear, the chances of you developing cervical cancer are low. Not saying impossible, but low. So basically what I recommend to my patients after 65 is, even though they're happy that they don't have to see me anymore for a pap smear, I still encourage them to come in every 2 years, because basically at that point, what I do is a pelvic exam. And I check to make sure I'm not feeling any masses in the ovaries. I check to make sure I'm not feeling any masses in the vagina. And I also check to make sure that I'm not feeling any masses on the cervix. If my patient still has her reproductive system, I always look for that after 65. Unfortunately, the older that we get, we are at risk for cancers. So that's why I still encourage my patients to come in every 2 just for a pelvic exam. Not a pap, but a pelvic exam. Now, as far as somebody not requiring a pap at 40, 45, or maybe even 38, these are patients that probably have had a hysterectomy in the past, meaning that they do not have a uterus or a cervix any longer. And if they don't have a uterus or cervix any longer, then your pap smear essentially is not checking for cervical cancer. So these are people that do not have to have a pap smear if they have a hysterectomy and they don't require, they don't have the cervix any longer. And also the surgery has been for benign reasons, meaning it could have been removed for fibroids or bleeding. And that is really most in a nutshell regarding pap smears and the frequency in when you get it. I'd like to move on to another subject that I'm asked about quite a bit, and that's menopause. The definition of menopause is the absence of a cycle for 1 year. That is the true definition of menopause. So let's say you stopped having a period 6 months ago, and all of a sudden you started to have another cycle. That 6 months doesn't matter anymore. That countdown starts from that last period. So every now and then I'll get a patient that she almost made it a whole year, and all of a sudden she gets a cycle. Well, that 11 months, she has to start the countdown again. Statistically, menopause starts at about 51 years of age. The symptoms are, as I mentioned, oftentimes the absence of a cycle, but sometimes people are perimenopausal, where they're still having a cycle, meaning peri means around. So they're essentially flirting around menopause, not quite there yet, but they're having a cycle, but they may have symptoms like hot flashes, night sweats, labile moods, and a big one is vaginal dryness. Most of my patients are still very sexually active, so vaginal dryness can be a big issue for my patients. Now, how do I feel about estrogen and medication? To some degree, some of my patients need it. When they come in and let's say there is the husband is with them or the daughter is with them, then that patient may need a hand. Also may need some medication, I should say, like estrogen. Now, there are some non-hormonal medications that I do try for people that may have mild symptoms. But sometimes we have to bring out the big guns, and we will do Premarin or Imvexy, estrace, but I try not to use hormones because sometimes, the patients may not need it. For vaginal dryness, you can use an estrogen cream, but oftentimes I get away with a compound pharmacy that makes up a medication for me that has a vitamin E and a vitamin A in it and hyaluronic acid. And that typically helps with vaginal dryness as well. So do I believe in hormones? Yes, to some degree, but there are some issues where the patients can get away with not using anything at all or versus non-hormonal medications. Now, Ms. Boatman also wanted me to touch on fibroids. Fibroids, pretty much if you're a Black person, you know somebody with fibroids. Fibroids affects 80% of the female Black population. Why we're affected more often, well, that's still something that the researchers, we're still working on. Fibroids essentially are tissue, normal tissue, but they turn into tumors. They turn into almost balls inside the inside or on or in the muscle of the uterus. And basically, these fibroids, it's almost as if, this is a theory because we're still not quite sure how often they come, but they typically start like a single cell that becomes very, very sensitive to estrogen. And they just expound and they grow. And that's when we see these fibroids. Now, fibroids don't necessarily mean cancer, nor do fibroids turn into cancer. There is a term called leiosarcoma, but that's for another time. That is cancer from the very beginning. But fibroids are typically benign. Sometimes you need surgery, oftentimes you don't. There are often times that we can remove the fibroid, and there are often times where we also have some radiological treatment that can block those vessels that lead to the fibroid and cause them to shrink. Those are called uterine artery embolizations. And I actually send patients to the radiologist to have those quite a bit and have been very, very, very successful with those. But other than that, the big thing is to make sure that you are not having a significant amount of bleeding. And we look at bleeding as a pad an hour when you're on your cycle. That's gone to a hemorrhage. So we want to make sure that you are not doing that. So that's pretty much it for fibroids. I didn't want to make a long talk about that. But we want to make sure the main thing is that your heart healthy. That is the #1 killer among females. We want to make sure that if there's any persistent dry cough, you also talk with your primary. Lung cancer has been very traumatic and very detrimental in the African female population. And I also want to make sure that you consider your COVID vaccine. I think the vaccine is extremely important, and I hope that you will get that so that we can get back to living and having our normal lives back. I want to thank you. I want to thank Lazet Boatman for allowing me to speak with you. And I hope these small pearls help you